I'm Kelly Pfeifer. I'm with the California Healthcare Foundation, and I'm here today to talk about the Care Excellence curriculum that CHCF and the SCAN Foundation commissioned from the California State University. We're very proud of the Care Excellence program because it addresses a key need faced by managed care plans. How do they help patients who have a complexity of conditions, medical problems, housing problems, mental illness, addiction, not having enough food, all of the things which can impact their health care, which we normally don't think is part of a health plan benefit or part of standard health care. But if you don't have enough to eat, you can't control your diabetes. If you don't have a place to live, it's very difficult to manage your medical conditions, and control of your diabetes is the last thing on your mind. So when health plans took on more complex populations, when they started managing people which we call duals, people who have Medicare and Medi-Cal, who are older, who are poor, who have faced a lot of trauma in their lives, the health plan staff were not equipped to be able to know how do you help someone who doesn't have housing when you're sitting in a cubicle at a health plan. What we learned is that in order to help health plan case managers do their job, they need to think about case management differently. It wasn't about calling patients on the phone and telling them to exercise or eat better. We know that never works when someone tells me to exercise or eat better, and it certainly doesn't work just with someone who's struggling with food insecurity or struggling to know whether they're going to have a place to stay next month. So we actually brought in experts across the country, including the Camden Coalition, who was made famous by Atul Gawande's New Yorker article called Hotspotting, which talked about the work they did in Camden. And they would find patients who had holes in their ceiling, who had mold and mildew and cockroaches, who nevertheless had told them, yes, we got a call from a health plan case manager who told me to exercise and eat better, clearly missing the boat about what was most important to that patient's health at the time. So we brought in Camden Coalition and other experts, and the California State University created this exciting new curriculum that helps case managers fresh out of school understand the needs of these populations, and most importantly, understand how to earn trust. Because whether you're meeting someone for the first time face-to-face or you're meeting someone over the phone, if you're going to make a difference in that person's life, you have to convince them that you are worthy of their trust and that you have something to offer. So what this case management curriculum does is it teaches people new in their careers, how do you engage patients, how do you get them to stay on the phone, believe that you can help, and then what kind of case management or helping actually really works long term. As I mentioned before, being told what to do doesn't help, but Camden Coalition developed this new model called I do, we do, you do, which means if we're going to try and do something new, I'll do it for you the first time. The second time we'll do it together. And the third time you do it, and I'll be your coach in the background to help you succeed. And what they're finding is that when you do this I do, we do, you do methodology, people are much more likely to learn skills and be able to take care of the things they need, even when the case management stops. So our goal at CHCF and the SCAN Foundation was to help health plan case managers get the skills they need to make a difference in people's lives when their problems are not necessarily healthcare related, when they're related to their environment or their social needs or their mental health needs.